You guys remember that presidential physical fitness exam we took in high school? It's gone now, not sure why, but I'm bringing that back. We're bringing that into medicine where it belongs. And when you think about an annual exam by your physician, isn't it a bit odd that we haven't looked at that? So let's talk about it. Why are we bringing in a fitness assessment to every individual? And this is not meant for athletes, or I put it differently, it's not meant for people that consider themselves athletes. If you move, I think you're an athlete, and I'll convince you of such over the months ahead as we work together. But there's a reason why we do this. To understand that your physical health is as important to your longevity and wellness goals as anything you put in your mouth and any supplement you take and any amount of sleep you get, will help you kind of frame that the value of us measuring this can then put it into a context for you that sets goals to achieve. These don't have to be event goals like a marathon, but it's more of a functional goal, a goal of balance, of movement. We will assess things and inform you along the way about why we are doing it. Everything's very intentional and has evidence guiding us that suggests that these markers predict an individual's fitness, which correlates with their lifespan. Lifespan's how long you live, their health span, how healthy you are during the years that you're alive. So things like grip strength. Why would that matter? Well, is it itself the thing that keeps you surviving, or is it a surrogate or a representative of a fit individual who is not frail? The frailty of a low grip strength infers someone who, if they fall, can't break their fall and might injure themselves, which can be a very detrimental and big step backwards in someone's health. So we can get ahead of that. We can measure it. We can track it. We can give you activities to move that needle. But there's a favorite saying that you'll hear from me a lot, which is that which is measured is managed. I think it comes from the marketing world. I'm not sure who said it there, but it's an impactful thing. And if we're not assessing something, we're not improving it. How can you? How would you know if it was improving? So the value of assessing these things gives us, your care team, and you, the star of the show, the knowledge to assess what you have to do to fix that number. And that's part of our goal for an assessment of your physical fitness. And that involves both what we call structure and function. Structure is, what the body is looking like from lean mass, muscle mass, fat mass, which some people think is the biggest thing. We're more concerned with a certain kind of fat. That's what we call visceral fat. Your bone density. Everyone thinks about their bone density and has heard of bone density, but you'd be surprised how many people have impaired bone density at very young ages that did not think they did. We are learning this because we are doing this on everybody. And everyone, honestly, from 40 years on, we are recommending a bone density assessment. And if you're a swimmer, cyclist, or runner and you don't do heavy weights, we're going to recommend it from your 30s and on, because the data has shown that you'll see early changes as young as 30s, a 30-year-old individual who is doing non-resistance activities. So the components there are important because we want to look at all aspects, not just strength, but cardiovascular function, measured in several factors: VO2 max, which you've heard about maybe, lactate clearance, which we can explain in depth more, but also balance, agility. And this is different than strength. This is the ability to stand on one leg, to brace yourself when you stumble, to know your position in the world when you have your eyes closed. These are different things that are parts of the brain that we want to engage and regularly assess to make sure that they are indeed improving, or at least not declining. So this is something new, different. We have some exciting partners we're working with the group that I am a part of as well, called Superform. and then select individuals in the performance space that will really just bring to the table a level of expertise and insight that, frankly, those of us in the medical field, in traditional medicine, trained in traditional pathways, have not been educated on. We were trained in diseases, how to manage them, how to stop them, not stop them, keep them at bay, let's say. But we're in a new world now, and it's in this exciting place. So this is an important aspect of the practice. It's as vital a sign as your vital signs. And so begrudgingly, stick with us, follow the program. We'll work with you on this. But your heart rate, your respiratory rate, your blood pressure is as important as your grip strength, your VO2 max, and your lactate clearance. And we'll help you along the way to understand them and to optimize them.